My name is Autumn Daniels. I am an assistant to Becky Sanders at the Upper Midwest Area Community Telehealth Resource Center. Sorry. It's good to be with you. I hope you enjoyed the presentation for today.
Thank you. Autumn will be posting everything, both the recording for today and the slides on our website, and she will be sending you an email once we've got all that up. All right, looking to see if looks like we're holding steady on our attendees, so I'll go ahead and get started. My name is Becky Sanders. I'm a Senior Director at the Indiana Rural Health Association and Program Director for the Upper Midwest Telehealth Resource Center. Thank you for joining us today. Here in Indiana, it's a cloudy, overcast, rainy day. If you're in northern Indiana, you may be getting snow. So today, our virtual office hours, and these are shorter presentations. We like to make them a little bit more interactive, but we did have over 80 people register, and that's a little bit hard to do, hard to facilitate as an interactive discussion. So we'll probably stay in the webinar format for today. The chat function, you can use the chat to ask technical questions. And if you're having any issues, know that you are all muted in listen-only mode for today's event. You can use the Q&A to ask questions. We'll answer them either live or via the Q&A function. I will stop and check for questions between the different states. We're going to cover state Medicaid waivers and reimbursement for the 4 states that we cover: Illinois, Indiana, Michigan, and Ohio. And I'll stop between states before we move on to the next state for questions. All right, so in alphabetical order, we're going to start with Illinois. And before COVID-19, Illinois reimbursed for live video medicine and telepsychiatry for specific providers. You can see that on your list, on the list there on the slide. They were asking for telemedicine bills to be billed with the appropriate CPT code and the GT modifier. They didn't have anything prior to COVID in their legislative rules for Medicaid or Medicaid guidelines about store and forward telemedicine, and that's like taking an image, like think about dermatology or you know, something like that, primary care where you've got a rash or a cut, a wound. They did and still do cover home uterine monitoring. They had a kind of what I consider a partial parity rule. Excuse me. So parity is coverage mandated by the state for specific commercial insurance or private insurance providers like Anthem, United, Blue Cross, Humana, Cigna, Aetna, those types of providers. And the rule prior to COVID-19 stated that they're not required to cover telehealth services, but if they do, they have to meet certain conditions. And that link there at the bottom, I believe was updated in somewhere in fourth quarter of 2019. We have not updated any of our state guidelines yet with information from COVID-19. Things have been changing too rapidly for us to make those changes just yet. So if we have time at the end, I'll point you to some resources on our website, but you'll have to kind of piece together information from a couple different places to get the full picture. All right, so of our 4 states, Illinois issued their executive order, their state emergency, and then they expanded telehealth services by executive order on March 19th of this year. And there's the link to that particular executive order. It was Executive Order 2020-09. And it defined telehealth services to include all of the services that you see there, regardless of their location. So patient could be at home, provider could be at home, those types of things. It specifically addressed the platform or the methodology of the delivery of the clinical care to be via electronic or telephonic methods. So you could, and at the federal level, HIPAA requirements have been waived or relaxed during COVID-19, so that you can use commonly available apps for video conferencing, such as FaceTime or Skype or Google Hangouts. These are not HIPAA compliant, but right now, the officials all want you to take the best care of your patients as possible. So you kind of have to be creative and do the best that you can. They do not want you to use what they call public-facing technology for video conferencing, and that would be like Facebook Live or TikTok or Twitch, some of those others that are out there. The Illinois executive order also required all insurance carriers to cover telehealth services by in-network providers with no prior authorization. Also ordered that health insurance issuers should not impose any kind of a cost sharing. So that would be a copayment, a deductible, a co-insurance. None of those should be applied for telehealth services. And again, there's the list of all types of providers. We've had a lot of questions specifically from Illinois about nurses, and you'll see here advanced practice registered nurses are included, but not nurses. So that's an area that we had to clarify. Also, and this is something different between Medicare. We're focused today on Medicaid, but between Medicare and Medicaid, Illinois Medicaid does cover for telemedicine dentists, occupational therapists, pharmacists, physical therapists, speech language pathologists. We've done other webinars regarding Medicare, and we'll be doing another Medicare update next week. That is not true for Medicare. So speaking right now specifically to Illinois Medicaid beneficiaries. There's been also a lot of relaxation of licensing rules, and I will try and remember to get that to, I don't have it in my slide deck today, but I'll get that to Autumn to send out and with the email when everything gets posted. But the Federal State Medical Board has a list of all of the different states and then their different actions. So if you happen to be in a border area, which is common, if either the provider drove over a state line to go into the office to deliver services, or a patient drove over the state line to go into the office to receive services, they might be in different states now. So there's a little bit of play there. You need to double check both the physical location of the patient and the provider to make sure that they're in accordance with state licensing rules. Let's see. Oh, so I already talked about non-public facing remote communication products. If you are using a platform that is not HIPAA compliant, you need to let your patients know that there's a possibility that private health information or PHI could be at risk. And I already talked about Facebook Live, TikTok, and Twitch. All right. So that came out on the 19th of March, and then on March 20th, the next day, Illinois Medicaid issued their first provider notice that's specific to telehealth. And again, you're seeing that they must use a synchronous interactive telecommunications system. The originating site or the patient location can be the patient's place of residence, and the distant site provider can be one of any of these. So it's your normal list. Do note that physical speech occupational therapy is allowed. Dentists are allowed, local health departments. Those are some that are unique in each state, and we don't necessarily see at the federal level for Medicare. In this provider notice, Illinois Medicaid also mandated that the payment would be at the same rate as services provided, as if they were, when services are provided via telehealth, they're going to be reimbursed at the same rate as if they were provided in person. They also specifically called out virtual check-in codes, and originally in the March 20th Medicaid provider notice, they included these telephone-only codes, and then 10 days later on March 30th, they said use G2010 or G2012, and that aligns with Medicare rules on virtual check-in codes. Note that these virtual check-in codes can be done via telephone, but they are a lot less, they're lower reimbursement than a typical evaluation management code. Other services that are not technically telehealth services, if you have an online patient portal or an e-visit portal for your patients, it has to be an established patient, and you can use these codes here. These HCPCS codes, G2061, 62, 63, and the CPT codes. These are telephone-only codes. And then again, they have a lower reimbursement than your normal CPT code would have. And then all providers on the previous slide, plus FQHCs, RHCs, and encounter rate clinics. Illinois uses that encounter rate clinic for clinics that have an all-inclusive rate or an AIR rate or a PPS rate that they bill. All right. Again, there's a lot of information in this one. They specifically called out originating sites for the HCPCS code 3014 for the facility fee. They pay $25. It includes nursing homes, medically complex facilities for persons with developmental disabilities, other support residential providers, mental rehab, and other services not for telehealth services. Okay, so specifically for hospice agencies, they want you to use revenue code 657 with the HCPCS code 3014. Now note, if the patient's at home, you're not going to bill this Q3014 because there's no clinical facility that needs to be reimbursed. They want you still to use the GT modifier and the place of service 02, so same as prior to the public health emergency, except if you're a community mental health center or an independent practitioner. And then I would encourage you to look at the handbook for specific guidance on that. Also, they address dental in this provider notice on March 30th. The dental dentists do not need to have a current or previous relationship with the patient to provide services via telehealth. They do have 2 special codes for teledentistry. There are new distant site procedures, the GT and the place of service 02. And then they've got some follow-up inpatient consultation codes and emergency department codes. For encounter rate clinics, you can use audio only and be reimbursed at the health encounter rate, which is great, but it must meet the key components of a face-to-face encounter. So, what's in your checklist for a face-to-face encounter, if you can't do all of that, then you need to use the virtual check-in codes or the online portal service codes, which are reimbursed at a lower rate. All right, and then all of that information you can link to through, this is the main site for Illinois executive orders, and this is the main site for Illinois Medicaid provider notices. All right, so I'm going to stop and ask some questions here. Let's see. Let's do this one first. Under the executive order, are payers required to cover telehealth services if the provider is out of network? Now, that was specifically addressed in the first one I went over. I am going to, one of the reasons we ask you to use the Q&A function is that we can go back and research that. I'm going to research that because I don't remember off the top of my head if I've seen the out-of-network. So that's a good question, but I want to clarify before I answer that. For states that don't have parity laws in place, does the executive order require payers to reimburse at parity? This executive order is specific to the state of Illinois. So I'm not sure I understand the question. If you could provide some more information, maybe I can answer that one. While not considered telehealth, Medicare is now allowing e-visits and telephone visits. Yeah, okay, so this is specific to PT, OT, and SLP, so physical therapy, occupational therapy, and speech language services. It is how do I best answer this? On the 30th of March, when Medicare added 80 new codes, it included new codes that could be provided via telehealth for physical therapy, occupational therapy, and speech language therapy. However, Medicare did not expand the list of providers. So a physical therapist, occupational therapist, speech language therapist can't provide that service via telehealth. They can, however, use the telephone only codes or the virtual check-in codes. So yeah, that's an area I'd love to see further clarified by Medicare. CRNAs in a pain management setting, are they able to provide telehealth services? This is a cost setting as well. Let's go back. I didn't see CRNAs on the Illinois list. Let's go back and look real quick. I don't remember off the top of my head if they're on the Medicare list. Let me see if I can find my Medicare bulletin real quick. All right, things are changing so rapidly, it's hard to keep up with everything. I thought, no, I do not see CRNAs on the Medicare list, and I also do not see them on the Medicaid list, so that would be enough. All right. Any other questions on Illinois before we move on to Indiana? Okay. For OB providers, how does a physician bill for remote telehealth services that would have been reported with a HCPCS? When you provide telehealth service, in general, you're going to use the same CPT code or the same HCPCS code that you would have used before. You're just going to bill it with the distance site modifier of GT and the place of service 02. All right, great question. Yes, we're not specifically covering Medicare today, but to answer that question, Medicare has changed the way they want services billed, and they want you to use the place of service where the patient would have been if not for this public health emergency, and they want you to use the modifier 95. For pediatricians, GT, well, it depends. Is your pediatrician billing Medicare or are they billing Medicaid? It depends on who are you billing as to what GT modifier and POS code you use. Lisa, Medicaid. So pediatricians in the state of Illinois for Illinois Medicaid would use the GT modifier and the place of service 02. Yes. Okay, I think that's it. All right, let's go on to Indiana. So before COVID-19 happened, in the state of Indiana, Indiana Medicaid reimbursed for live and interactive telemedicine, not for store and forward. That's typical here in the Midwest. They wanted patient consent to be kept at both places. Earlier this week, Luke Wortley did a virtual office hour specific to documentation and consent, so I'm not going to really answer questions on those today. I'm going to refer you to our archived webinars. Those are already posted. The slides are there and the recordings there. Indiana had already, back in 2017, said that patient-provider relationships could be created on a telemedicine visit subject to clinical standards, and that once that relationship was established, you could issue prescriptions and then controlled substances as well, subject to DEA waivers. Just to note, I don't have the slides on this. If you go back to the slides in the recording from April 10th, I've got slides on the DEA waivers. Right now with the DEA, you can issue controlled substance prescriptions as long as you're within the scope of practice and you have the DEA waiver or you're at a DEA facility, even if you've never seen the person before in an in-person environment and you're seeing for the first time via telemedicine. And that's for all states. Indiana's commercial or private insurance parity rule said that if they covered the service in person, they had to cover it via telemedicine. Also, again, on a national basis, really right now, all providers, all commercial insurance or private insurance are being asked to cover telehealth services. So we're going to see that in all the executive orders we cover today. Again, the link at the bottom, and we were working on an update to this one, but we didn't make it out before COVID. So right now, this is the one that's out there is from the fourth quarter of 2019. Earlier this year, Indiana, their Indiana Health Coverage Programs, which is our Medicaid program here in Indiana, did add speech, language, voice communication for a Medicaid service. The executive order for the state of Indiana also came out on March 19th. It suspended all telehealth restrictions. So Indiana's Medicaid is Family and Social Services Administration. So they have to waive all premiums for the Children's Health Insurance Program. They're waiving job search requirements. D here specifically talks about telemedicine. Suspend telehealth restrictions, telemedicine restrictions, and requirements for face-to-face encounters. And we'll see the Medicaid bulletin on our next slide. So that's all that is in the executive order. So for the Indiana Medicaid that came out on the 19th of March, this is the language here. There's several pages of it. Again, here you see in the middle of the page talking about technology. They still want you to use a real-time interactive consultation. It does include voice only, but not non-voice communication such as email or texts. So each state Medicaid program is a little bit different. You'll have to make sure that you're following the rules for your state Medicaid program. Here it talks about HIPAA waivers or relaxation of HIPAA rules. There are some specific code sets for telemedicine services, and coverage right now during the public health emergency is not limited to those codes. Certain services, surgical procedures and that kind of stuff cannot be delivered via telemedicine. That makes sense. They still want the valid procedure code, and they want the GT modifier. And here a note, so the do not bill place of service 02 or modifier 95, and this will cause the claim to be denied. So they just want the GT modifier. All right. And then a further Indiana Medicaid bulletin came out with a lot of FAQs on April 1st. I'm not going to run through all these. We originally scheduled this as a 30-minute call, so I'm going to move on, make sure we cover Michigan and Ohio, and then if there's questions, we can come back to these. You've got the links, you'll get the slides, and you can go and check out these FAQs. Controlled substances, we kind of talked about that already. No geographic limitations for Indiana Medicare. They clarified the place of service. So here they do say use place of service 02. If the member is located in his or her home, they want you to use POS 12. And then there's a place of service code set there. Pay at the normal rate based on the CPT code. Again, patient documentation and consent. We talked about that. HIPAA compliance, we talked about that. Technology, we talked about that. Yes, you can establish the relationship. And then here are some specific things to FQHCs and RHCs. We're working on having a webinar next month in May, specifically to FQHCs and RHCs because their billing is a little bit different. So we're working to schedule a specialist to come in and talk to you for that next month. So stay tuned on that. All right, here is the main site to go find executive orders from the state of Indiana and also the Indiana Medicaid bulletins. All right, so questions. Let's see, 10, that one we got. Speech audio, 20-13. Let me go back. Dawn, would you email me? Yeah, and Autumn has already put my email in that list. I don't have that up right now. I'll get back to you on that question about speech, occupational therapy, and physical therapy. Indiana rules for border state providers. I'm going to refer you to the FSMB licensing information on that. Audio only visit codes differently. I haven't seen, if anybody else, if I've missed it, I haven't seen anything on those audio only codes for Indiana Medicaid. Doesn't mean they're not there, but I haven't seen it. All right, let's move on to Michigan. Okay, so before, and Michigan and Ohio are going to be interesting states to talk about. So in, again, fourth quarter 2019, Michigan Medicaid reimbursed for live and video telemedicine and certain healthcare professionals at certain originating sites for specific services. Okay, they didn't reimburse for store and forward. They had consent law in place, and they had some laws about prescribing of controlled substances, and they did have a pretty healthy parity rule that the commercial providers had to pay. Their executive order declaring the state of emergency came out on March 12th, and it didn't have anything really specific to telemedicine in it, but on March 12th, let's see, that was March 10th, sorry, and then on March 12th, the Medicaid Bulletin hit, and there's a lot of stuff in this. The state of Michigan, the Michigan Medicaid Department, was already in process of opening up telemedicine rules in their state to allow the patient to be at home, even before all this stuff happened with COVID-19. So it's very, very good for telemedicine at this point. So again, you see consent laws, they define telemedicine as interactive audio or video. Let's see what else we want to do. I listed all this just so you'd have it in the slides. I just want to point out a couple different things. Home is an eligible location where the beneficiary can receive services in a private residence, and it's an eligible originating site. Local health departments are also eligible for telemedicine services as an originating site. And then there's here the other authorized originating sites, and this is your typical list. It's nice to see SNFs on there. Skilled nursing facilities are also on the Medicare list. Tribal health centers, local health departments, home. So that's good. Let's see. A change for March 1st. So the provider can be at their office or any established site considered appropriate by the provider, so long as privacy of the beneficiary and security of the information are maintained. So basically, they don't want them to be at Starbucks or McDonald's or something like that. The telehealth service fee, the facility fee, here they're talking about the Q3014. Neither the originating site or the distant site is permitted to bill both the telehealth facility fee and the code for the professional beneficiary service at the same time. And then this facility rate, they're saying that this goes into effect on June 1st, which is kind of strange considering that this is effective March 1st. I do not have clarity on that. Place of service and modifier. So they also want you to use the place of service 02 and the telehealth modifier GT. FQHCs and RHCs, they can be an originating or a distant site provider effective March 1st. Distant site providers must maintain all practitioner contracts. There's more stuff on claims. Okay. The Michigan Medicaid Bulletin also included a full list of what they have in their telemedicine services database, which is the Michigan Medicaid list of approved codes for telemedicine. And they also included a list of new codes that they've added just for COVID-19. So you can see that here, some of these by their coloring here. If they're yellow, then they're approved for COVID-19 purposes. And some of them you see yes on COVID-19, but no and currently allowable via telemedicine. So that is Michigan. Here's the main site for all the Michigan executive orders and the main site for all the Michigan Medicaid bulletins. Any specific questions for Michigan Medicaid before we move on to Ohio? Okay. Ohio is also in a really good place for telemedicine. They did some sweeping changes to their telemedicine laws in July of last year. So they'd already opened up home as the originating site. And there's the list of all the other places that a patient could be. It does exclude a jail or penal facility. And there's no place of service restrictions for the practitioner if the patient is active, practices a patient-centered medical home, or the service is provided in an inpatient or office consultation. And this is all pre-COVID-19. They created their parity rule. The language around that was enacted in July of last year, but they didn't actually make it take effect in their state budget until the 1st of January of 2021. So COVID-19 is kind of upped that, and right now all commercial insurance providers are mandated to pay for telemedicine services. So here we see March 9th is the official declaration of state emergency, and March 19th they came out with an emergency telehealth guidance, specifically via executive order. And then Michigan's got or I'm sorry, we're on Ohio. Ohio has a good, Ohio Medicaid has a great information list on their Medicaid page, which includes not only executive orders, but all of the Medicaid stuff. And they've got some great frequently asked questions, and they've got different versions of those. This telehealth billing desk guide is a good guide, all of this information. So because they were already so far in advance and already opened up so much, there wasn't too much really to talk about from their expansion order. It did ease some pharmacy benefit restrictions, in and out of network provider status. Prior authorizations were relaxed, and the patients could seek telehealth services from any authorized provider regardless of in or out of network status. All right, questions about Ohio. Here is some additional information regarding the audio video. So they're allowing both audio video or asynchronous. They're allowing telephone calls, images through fax, and electronic mail or email. So this is Ohio Medicaid only that is allowing these three things. Patient can be access telehealth wherever, home, school. I hadn't really seen homeless shelter in any other language. If you're an FQHC or RHC in the state of Ohio, they want you to use the T1015 encounter code, the GT modifier, and the place of service as the practitioner site. They are also allowing dental, hospice, home health, nursing facilities, and then there is a full list of CPT HCPCS codes, modifiers, and billing samples in this particular link here for their telehealth billing guidelines during COVID-19. Question, did they remove the exclusion for jails? I have not seen that. Doesn't mean it's not there, but I have not specifically looked for it. So I'd encourage you to go ahead and look at all of their frequently asked questions. And again, here is the main site for Ohio for their executive orders and for their Medicaid orders. All right. Couple other things I want to throw in here. We used to talk about the telemedicine room being in a clinical setting and all of those things. But right now, the reality is you're probably seeing healthy patients from home. So you need to consider privacy, both on the side of the provider and on the side of the patient. You want to make sure that they're in an appropriate location. You want to think about your website manner as a provider. Looking professional, try and do what you can with your lighting. I've got a daylight up there that provides extra light. So cloudy today, I do have my blinds open on my window over here, but I don't want this half of my face to be in shadow. So proper video etiquette. I'm trying to look at my webcam directly so it looks like I'm making a personal connection with you. Also consent. You need to make sure that you have consent. If the best that you can do is verbal consent, then you can put a picture up of your consent form, read it to them, and mail it to them or email it to them or whatever later. Vital signs, there's been a lot of talk about how do you do vital signs when the patient's at home. Most houses do have thermometers, so let the patient take their own temperature. If they've got a blood pressure cuff, let them take their own blood pressure cuff. Let them take their own blood pressure with their own blood pressure cuff. If they're wearing some type of a device that tracks their pulse, or if they know how to track their pulse, you're going to have to be creative and do the best you can during these unprecedented times. All right, any additional questions before we wrap up? All right, my contact information, Luke's, I'm sorry, Autumn, I should have added yours. If you want to put your email in the chat, you can. Different resource pages on our website, links to, we've updated our frequently asked questions. We have a specific COVID-19 resource page on our website. All of our webinars that we've been doing in April are on our archived webinars page, along with the slides for them. You can sign up here to get our newsletter. It comes out at the beginning of each month. We're working on May's content, hoping to offer a lot more content in May. And there's our website. If you email info@umtrc.org, you're probably going to talk to Luke. He's been heading up our technical assistance. And you can actually fill out a form on the website with this link here and ask specific questions. And he will probably be the one to respond to you. All right, any last minute questions before we wrap up for today? All right. Well, thank you all for joining us today. I hope this was helpful. And look out for, be on the lookout for an email from Autumn with the recording and the slides from today. Thank you.